I'm Sophia, a second-year student pharmacist at the University of Wisconsin-Madison School of Pharmacy. One of the benefits of being a PharmD student at UW-Madison is that you get to learn in a major medical hub and leading health sciences campus. The partnerships between the School of Pharmacy, the UW Health University Hospital, and Madison Veterans Hospital are an amazing benefit. And guess what? They're right across the street. This has given me some of the most insightful and unique experiences with direct patient care. I recently had a life-changing clinical rotation at the University Hospital. The hospital is known for its excellence in managing trauma. I was lucky enough to attend rounds in hospital codes and observe interactions between pharmacists, nutritionists, physicians, nurses, and other health professionals in their intensive care unit and trauma life center. The culture of these surrounding hospitals and health professional schools is very pharmacy-friendly. It's a place where all care providers value and seek pharmacist input. As a pharmacy student, I've appreciated the activities embedded in our curriculum, where I've already been able to collaborate with nursing, medical, occupational, and physical therapy students, and more. It's given me a proper understanding of the collaboration I will experience daily as a future pharmacist. It's really great learning in a major medical hub because I have incredible opportunities to experience patient care at a major hospital. And being on a leading health sciences campus has provided me with unique interprofessional learning. And that's just a glimpse of what sets the UW-Madison School of Pharmacy apart from the rest.